online audience. This is our first OEH seminar of 2017. Woohoo! So yeah, today we have the esteemed Dr. Angela Eykelbosh. She's here to talk to us. Dr. Eykelbosh is an environmental health and knowledge translation specialist working at the National Collaborating Center for Environmental Health and the BC Center for Disease Control. She holds a PhD in resource management and environmental studies, as well as previous degrees in physiology and toxicology. She's also an alumna of the Bridge program at UBC, which is an interdisciplinary research training program that unites public health, engineering, and policy. Her knowledge translation work covers many topic areas, but generally she seeks to help knowledge users find and contextualize scientific evidence relevant to environmental public health issues. Today she's going to speak to us on oil spills, scoping the issues for environmental public health, emergency preparedness, and response. Without further ado, please welcome Dr. Angela Eykelbosh.
Hi, thank you very much. And I apologize right now for that massive title. I didn't intend that to happen, but as I kept thinking about the subject, I was like, I need to insert a word here and a word here, and that resulted. So thanks again for having me here today. As was mentioned, I'm Dr. Angela Eykelbosh, but just Angela is fine. I'm going to be talking to you about a few things today. First of all, I'm going to describe to you a little bit about the role of the National Collaborating Center, which is where I'm from, as well as the BC CDC. Oh no, it's not rendering properly. We're also going to be talking about what we know about the health effects of oil spills, which is just basically what's documented in the literature for major marine spills. We're also going to be talking about the key issues for environmental public health response, which is what I'm getting very involved in now. And I'll also be telling you a little bit about some upcoming initiatives and research about oil spills and environmental health. This is very topical because, as we know, the Premier has given her blessing to the pipeline this week, so this is now very much of concern. So the National Collaborating Centers for Public Health is a group of 6 actually collaborating centers that came about as a result of the SARS incident, or SARS crisis in 2001 to 2003. And so basically there was identified issues with accessing high quality and relevant research evidence for developing health policy. And so when the SARS crisis happened, this became very, very apparent. And as a result, the NCCs were created in 2005 by the Public Health Agency of Canada. So we have national funding, we have a national mandate, but the NCCH, which I am part of, is actually hosted by the BCCCC. And the other 6 collaborating centers down here, Aboriginal Health, Determinants of Health, Healthy Public Policy, Infectious Disease, and Methods and Tools, are located in different centers throughout Canada. So we all work together and separately for our stakeholders, and our main goal is really to synthesize, translate, and exchange knowledge, or facilitate knowledge exchange. And we do that by incorporating evidence from research and from experience from other people working in the field to develop or improve developing policy and practice. So a large part of that is actually just evidence review and identifying gaps in knowledge. We also seek to build capacity by providing tools and establishing networks, fostering partnerships. We get involved in research, so we're really out there trying to connect people with similar problems. Our target audience are mostly public health inspectors and environmental health officers at the field level, and then at the policy level, medical officers of health and other environmental public health practitioners and policymakers. So we got a big reach. So why is NCCH interested in oil spills? So we receive inquiries, requests for information all the time, and we have identified in our previous needs assessments from practitioners the need for more information on pipelines and past spills. So nobody here is surprised. We've been talking about the Northern Gateway pipeline and the Trans Mountain pipeline for the last 5 years now. And so this kind of has been really increasing awareness of pipeline-related and oil-related health issues across Canada. So the BCCDC and NCCH have actually been asked to consult in previous fuel spill responses, and especially just in BC. And we have been collaborating with Vancouver Coastal Health, First Nations Health Authority, and Health Canada in developing some potential responses to some of the issues we've encountered. So our really basic objective is just, especially you'll see from this presentation is really the culmination of a lot of different things that I've been doing and trying to pick out the threads or themes of the problems that we're facing with oil spill responses. So to scope out those issues facing our environmental health practitioners, and then to facilitate the sharing of knowledge, which is not an easy thing when you're talking about emergency response. So I'm going to be referring to a bunch of different documents in here, and I really want to encourage you folks as students to go to our website, ncch.ca. We have a lot of resources, not just about oil spills, although I have some really great webinars from different events like the Lac-Mégantic trend derailment, as well as the recent Bella Bella spill that are of interest, but then many other areas of environmental health. It's actually a great resource for a student because it's kind of like the Coles Notes on everything, so it really reduces your effort to getting information. So my involvement with oil spills, hey Mike, started in 2014 when I was a bridge student, and Vancouver Coastal Health needed somebody to write a lit review on the health effects of oil spills. So like literally this is just bridge program, straight to work, and I'm still doing this now. So at that time the Trans Mountain Pipeline process was in full swing, and Vancouver Coastal Health was getting a lot of requests for information from different municipalities about the potential health effects. So people were really, really concerned. VCH realized that we don't actually know that much, and the literature out there that has been focused on summarizing these studies hasn't done a very good job so far. And so we did, in about 6 weeks, because we had to meet a deadline for a document submission for the pipeline hearings, in about 6 weeks we did a massive literature review about the health effects of large marine spills on human health. So a lot of those that information, there was quite a shocking amount of research out there. And a lot of it focused on the Deepwater Horizon blowout in 2010. That was a big one. There was another quite large spill in South Korea called it was the Habai Spirit tanker. The Prestige spill in Spain had a lot of documents, as well as, of course, the Exxon Valdez in the 80s was huge. And then there was another spill from the Tasman Spirit tanker in Pakistan that affected a very large populated urban area that was really informative. So there's actually 2 papers on this. And I have been told by people who have responded to oil spills that these were so valuable they should be read back to front. So that's like the best feedback you can, that's the best feedback you can get. So the short paper for people with not super a lot of time is here. It was written with NCCEH, and it's at the nccH.ca website. And then if you're interested in the longer paper, which really goes a lot more into like the mental health effects, and community disturbance, that's in the much longer VCH paper that's on their website. Okay, so just quickly summarizing that endeavor, what have these large marine spills taught us about effects on human health? Well, we did find a lot of evidence of short-term health effects. And these are things like headache and nausea and respiratory effects. These were mostly reversible. They were reversible. I'm not going to say there was long-term headaches, but some of these effects were not precisely short-term. Sometimes they were lasting for days, 2 months, depending on the duration of exposure and the type of work that a person was involved in. So these kind of short-term toxic effects were really mostly seen in the cleanup workers. And that included both formally trained, properly equipped cleanup workers, as well as people with less training and less protection. So there was much less information on the long-term effects. There were a few papers from Spain that looked at respiratory, endocrine, and immunological effects, but it's really, and people really picked up on these papers, were like, yeah, long-term effects, oil spills bad. They are bad, but the effects that were noted in these papers were like very much subclinical, and so we really don't understand the long-term health significance of having a slightly elevated immune cell count. So. What was much more shocking and interesting for me, and I think for VCH, was the information that was available on mental health and community disruption. So obviously oil spills are very disruptive events. Even a small spill can be a very disruptive event, as we just recently saw in Bella Bella. You have people who suffer a rapid income loss, or they may actually experience a rapid income gain that can be also detrimental. In unexpected ways. People obviously have very intense health concerns, and in some cases, litigation. Just having to, like, this has happened and you're recovering from it, and then you have to go to court and fight for your rights and get compensation, and he got more than I did, and why is that, and I haven't been paid yet. These things are incredibly stressful on individuals and also very stressful in communities because they lead to a loss of social cohesion. So this was very interesting, and it was not really well represented in the literatures or in the reviews of this literature, so we captured that. So at the individual level, there were papers looking at anxiety and PTSD in individual people. And at the community level, there were papers looking at things like addiction, increases in domestic violence, in crime in general, and of course, problems with social cohesion. So oil spills are very disruptive. I know you guys are occupational health, so I just throw this in here. You may be really interested in this. And the cleanup related health effects of oil spills, you really saw a very differential risk depending on whether a person was a professional paid cleanup worker, so properly trained and monitored and rostered and like a lot of oversight over that person, versus volunteers with variable training or PPE, versus wildlife handlers who were trying to like degrease all the ducks. They tended to have a lot more of like physical injuries simply because they're being bitten and they might slip and fall, or also being trapped inside of rooms washing ducks. So all the VOCs are just kind of like in the room with them. And then, of course, there's people who just show up. And these people are, quote unquote, the worst people, not the worst people. They're the people we have to be most concerned about because they're the people who just dive into the water and they're up to their knees in oil. And so during the Marathassa oil spill here, I think it was somebody from the city was mentioning that they had actually, people were calling in saying, I want to help clean up. And they're like, okay, let's put your name on a list. And then they never called those people back because it was enough for the people to be on a list. It kept them away from the beach, which was really important. They didn't want people messing around. And also, speaking to somebody from WorkSafe BC, there's a real question about if you have volunteers come to the site of a spill like this, they're volunteers. Even if you train and equip them, you're not paying them, you're not their employer. So if they hurt themselves, do they get workers' comp? Right? It's a kind of like I don't know if that issue has been resolved yet, but it was previously a concern. So this picture, you may not know, is actually from an oil spill, a bunker oil spill that happened here in English Bay in 1973. And the response was immediate. People went down to the beach. They have some additional pictures later on in the show, but it really shows you that this is not something new for us. We've been dealing with this over the years, and the question is like, are we getting better at it? Is really kind of the end goal here. So if you're interested in this paper, it's written by I think he's a history professor from York University. It's a really interesting read. So one other thing that came out of our review was really a discussion of vulnerable populations. So people don't often think about the effects on children in oil spills. We tend to focus a lot on the cleanup workers and what their exposures are and what the long-term effects are. But because there's community and social disruption, of course, children are most definitely affected. So in the Deepwater Horizon incident, there was some studies on children showing increases in mental stress. And also in Korea, I think it was from Korea, there was a study showing that children's scholastic performance actually decreased, and they were showing signs of depression because they were concerned about what was happening in the community. So this just goes to the very disruptive event statement. Also, clearly, anything or any community that's a natural resource-based community, fishing and tourism and stuff like that, are going to be disproportionately affected, and indigenous communities. So especially in the Exxon Valdez, there was quite a lot of work done on indigenous peoples and the very profound effects that they suffered as a result of that incident. So it's kind of a combination of things. There's the reliance on traditional foods for their own consumption. There's also the need for commercial fisheries and like resource extraction for their economic well-being. There's also these very holistic views on health and the environment. If a fish is sick or a fish has been contaminated, but the toxicologist says it's okay, you still don't eat it because it's been not tainted, but it's not well. So you, of course, would never eat it, even though toxicologically it's quote unquote fine. So because of this, you could say that indigenous communities have been disproportionately impacted in past spills, and certainly when we talk about remote spills, sometimes a spill will happen out in northern Alberta in a muskeg, and the oil company will be like, it doesn't affect anybody, nobody lives there. But these spills are still happening in somebody's traditional territory, and people may be using it, and so that should always be considered. Okay, so these are just a few recent spills in Canada. These are ones that I've dug my little fingers into and tried to gather information on. So some we know more about and some not so much. Oh, I'm really irritated with the way this is rendering. The two spills, you can't see the bottom spill. Okay, For Lac-Mégantic, this was the train derailment in Quebec in 2013 that actually killed 50 people, or 47 people. And so for Lac-Mégantic and also the Bella Bella spill that I'll be talking a little bit about today, we actually have webinars on our website that are involve the people who were there and are really useful, insightful looks into what happened. So you can really kind of understand what not just the public health person experiences when they come to the scene of one of these things, but also the community themselves. So these are all, a couple of these we've, as NCCH or BCCDC, we've been invited to consult on, and so that's really where my knowledge is coming from, as well as public documents available for the rest of them, and some interviews that I did as well. So this is like very complicated to do, but emergency management in BC in a nutshell. Unsurprisingly, it's run by Emergency Management BC. And they oversee what is known as a BC Emergency Management System, BCEMS. And so this is a very comprehensive management system that oversees everything in BC related to emergencies, from mitigating the risk before something nasty happens all the way to recovery. And so it's a couple 100-page document, pretty easy read. Everybody should definitely check that out. It's really interesting. In the event of an emergency, we have something called a Comprehensive Emergency Management Plan, which is a two-part thing. The first thing this is what governs our actual response on the ground. So the first part of the plan is the all hazards plan, which is like the generic anything, this is activated no matter what happens. And then there's several, I think about 5 hazard-specific annexes. So for example, if there's a tsunami, you activate the all hazards plan as well as the tsunami plan. So we don't currently have a plan for oil spills, but there's a lot happening right now, right? Both the Minister of Environment is just finishing their consultation on a land-based spill response. So that's going to be probably, they'll be moving on that in the next few months, I think. And then as well, the federal government is, of course, moving money around and talking about making big changes to spill response. So there's a lot of things happening right now around oil spills, which is all to our benefit because all these pipelines have been approved. So in these plans, the really important thing to know is that the local authorities, which are the municipalities or the regional districts, they respond first. And then depending what happens in the situation, if they don't have capacity or if the situation is escalating, they activate higher and higher levels of the provincial response structure. And so that is a very structured and efficient way of activating the resources you need without having a full-blown response to everything that perhaps doesn't require it. So at the actual scene of the spill, and this is what most environmental health practitioners are going to interface with, this is a site-level response, and this is governed by something called the Incident Command System. The Incident Command System is just a fancy term for a response structure that is facilitating, and these are the really important 3 C's, command, control, and coordination. They answer the question, who's in charge and what's my job? If you show up to the scene of a spill, who's in charge, what's my job? So basically what this does is it groups activities like logistics, operations, planning, and finance under one incident commander or unified command of several incident commanders. So for the Bella Bella spill, for example, there were 4 incident commanders, somebody from the Coast Guard, from provincial government, from the responsible party, and from the Haltsik First Nation. So those 4 together were the unified command, and they were in control of this entire response, which I think ended on November 21st. So this is a somewhat hierarchical system. It actually derives from wildfire fighting in the 70s, I think, in California. And so it's very it's command and control. It's very hierarchical, but as it's evolved as an approach to all hazard situations, it's become a little bit more, I'm not going to say, there's consensus within the group, within the unified command group, or within the advisors, but then once a decision is made by incident command, everybody has to toe the line. And so that's very important for quick and efficient action. The primary objective here is to contain the hazard as quickly as possible to limit public exposure and damage to the environment. So this is how the incident command system protects public health, and it's very, very effective. So nothing I say today should be taken as a criticism of ICS. It's actually a really great system. We just have to use it the best way we can. So this is a very difficult slide. The role of the BC Public Health apparatus in an environmental emergency. So depending on what kind of emergency happens, different ministries are in charge. Okay, so if there is an outbreak, an infectious agent, or some sort of radiation leak, the Ministry of Health is a technical lead, and they're going to be very much at the forefront of whatever happens. Okay, for all other emergencies, including a chemical spill, agencies, all of these agencies provide expertise when called upon. So it's a much more ambiguous role when you have an environmental, what we say, or somebody might say an oil spill emergency is an environmental emergency, but for us, it's still an environmental health emergency. And so, but your role is much more, it's much more unclear what you're supposed to be doing because you're waiting to be called upon. So this is the structure that should be activated in an environmental health emergency like an oil spill. So you got your Ministry of Health on top. These are your health authorities. So we all know the regional health authorities: Fraser, Vancouver Coastal, Vancouver Island, Interior, and Northern. First Nations Health Authority is out here on its own because it's very special. It's not regional for one thing. It covers all First Nations in all of BC. And also they have a very different relationship with the people that they serve. They don't preside over First Nations, they work for them. And so it's a very different interaction. And then there's PHSA. So Provincial Health Services Authority has many different structures within it, but the three really big ones that are activated in an emergency are Health Emergency Management BC. They're mostly planning and kind of like the preparedness type activities, but during an emergency, they have a unit called the Disaster Psychosocial Services Group, which is a bunch of volunteer mental health professionals that can be deployed to help in a really serious disaster. So I think that's at the discretion of the provincial health officer. And then there's also BC Emergency Health Services, so that's mostly BC Ambulance, which is really critical for on-the-ground safety and decon and stuff like that. And then there's us. The BC CDC has two really important branches. The first is the Poison Control Center, and this is important because when people call us, or they call the Poison Control Center and they say, I'm having headaches and I was in the oil and blah, 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 we log that. We log that information, we log that person's information, and it's kept in a very safe place. And the reason why that's important is because we can use that information, theoretically, for public health research as a result of oil spills. So within the BC CDC, we're trying to understand right now how we can best use DPIC to answer public health questions if one of these events occurs. And then the other group that's important, obviously, is Environmental Health Services, which is my service line, and the NCCH, which is tucked within that. So it's complicated, right? The health authorities also have their own environmental health apparatus, so now you've got a lot of players, and you have to ask yourself, what is the role of all these environmental health experts in an oil spill? It's not very well defined. So part of the confusion that can occur is the role of environmental health practitioners in the incident command system in an environmental emergency. So local health, local EH, like local environmental health people, may not choose to be involved in ICS for various reasons. They may say, I'm going to give you advice, but I'm going to stay on the outside of this. And or they may not be included consciously by decision. There may be a decision made that they're not required, and so then they're not involved. If you are in ICS, there's advantages and disadvantages. If you're in, you're privy to information first, but you also have to abide by the decision of the incident commander. And this is really important because there's going to be some issues or situations in which that can create friction. So for example, there may be communities that are not super comfortable with hierarchical decision making and want to see more consensus decision making, and or there may be trust issues. So if you have a community that has an inherent distrust of federal agencies, because perhaps historically they've been burned many, many times, it can be very difficult for their public health advocate, their environmental health person, to be involved in the ICS itself. So this is one consideration that has actually come up. If you are outside of ICS, however, you can still provide your advice, and you should obviously make yourself heard, but it can be really difficult to get information back out in a timely manner. That's something that we hear time and time again. And also, if you're not part of the formal provincial health response structure, it can be difficult to get your activities reimbursed. So if you have to send somebody off to some exploding mine somewhere, they may not be paying your costs for your people to be traveling back and forth, and that can be a big barrier to responding. There's also some issues with communication, and this is no secret. This has been in the news, especially with the Marathassa. Vancouver Coastal Health wasn't notified of the spill until the next day. And just by total coincidence, couple days ago, I was talking to a person, and it turns out she actually went to Jericho Beach that morning with her toddler and went swimming. So this was before Vancouver Coastal Health knew. They were in the water in April, which seems really weird. But when they came out, the mother was coated with oil, but the toddler was coated with oil up to here. And this is really concerning. That kind of exposure with a child is pretty concerning. But they didn't contact. They went to their family doctor, but they didn't contact poison control or an emergency department, so we never heard about it, right? But these are the sorts of things that we get a little concerned about. Local environmental health may or may not be notified, and they may or may not be included in unified command. So there's definitely been some, discussion about what is the right thing to do in that situation. Some local health responders may not be very familiar with ICS. There is a lot of emergency management training, and there's a big push for capacity building across the entire province, but it takes time for everybody to access emergency management training, and also not everybody has the capacity to do all the exercises, the emergency exercises that are perhaps necessary. It's a very time-consuming and costly thing to do. So, we have had our environmental health practitioners come to us and say, what's incident command? And so for me, as a knowledge translator, that means, we need to do something. We need to do a webinar or something where we can start connecting people with that information. So there's also, so those are kind of all like the issues related to incident command and how we use it properly. The other really big barrier that environmental health people are experiencing is just simply the knowledge gaps that we have with respect to oil spills. And they're not small. So when an oil spill happens, the local health authorities really need to scramble to find the information and also the resources. So big issues are what has been spilled. It might be one thing, it might be a mixture of things. Are we sure that's what was actually spilled? Because it's very difficult later on if you put out certain messaging to backtrack and say, oh, but it was also this. That can cause a lot of problems. What do we know about this thing? So we have to start developing safety communiques to first responders, but also the community. There's always the desire to contact someone, phone a friend, reach out, find somebody who's done this before. We need help. And even if we were super prepared and had guides and training for everything, this would still be an important thing to do. The question is, who do you call? Right? We don't necessarily have, we have one very well-known environmental health person, which is Tom Kazatsky, and whenever something happens in BC, people call him, but he's one person, right? This is not necessarily the most resilient structure to have. We also have some issues with learning from each other's experiences. So we have something called the Canadian Disaster Database, which is basically, it's a database of all these events that have happened, but it's not very well known and it's not very well used. So the criteria for that database are you have to have 10 deaths or 10 or 100 people evacuated or affected before an event is registered in it, and that's just not, it doesn't actually make any sense. Like the Bella Bella spill didn't kill anyone, and nobody had to evacuate, but it's massively affecting their community and will profoundly affect them for a long time to come. So we need to be using this resource better. Also, reports of individual incidents are almost never publicly available. So either the reports are made and they're kept internal, or no report is made, and then the institute becomes, or the agency or authority becomes very dependent on institutional knowledge, which again is not very resilient. So for us at NCCH, this is a huge opportunity for engagement and collaboration with people, getting them to share their experiences and their stories. Like it's really storytelling. So that's why we started doing these webinars at NCCH. So we have had amazing response to the Lac-Mégantic webinar and the Bella Bella webinar because you can get a first-hand account of what happened there. So these are something we're really excited about. There's also some really severe risk communication issues. The health effects of an oil spill can vary a lot. There can be no health effects. There can be no health effects, right? That's possible. On the other hand, if there's a fire or an explosion, there could be mass fatalities. So the range of possible consequences are none to a lot. But outrage over an oil spill is always a 10. People are always very angry about any kind of oil spill that happens. And this is because of a bunch of different risk communication factors. Mostly it's a technological disaster, it's not a natural disaster. It's something that somebody did to you. You didn't do it to yourself, it wasn't an act of God. Somebody did this to you, that tends to increase outrage. It's also very exacerbated by the fact that we live in a post-trust environment. So a lot of the risk or environmental management people and environmental assessment people that I work with, they're always talking about trust, like it's some sort of pipeline you can use to jam facts down somebody's throat. But in fact, we should all be operating as if we are post-trust, because the truth is that public health does not command the confidence that it used to. And I mean, that's just the way it is. We're also much more cognizant of this idea of psychological exposure. So in Deepwater Horizon and Lac Mégantic, even the people that weren't directly affected by the oil, so for example, Lac Mégantic, 47 people died. And in that event, people who were affected either died or were completely fine. There was actually absolutely no injuries, like broken legs or broken arms, because it was really just the one bar that blew up. So those people died, and then everybody else was psychologically exposed to their deaths and continued to experience that over the next several years as they were followed. So that psychological exposure is something that now we're realizing we have to assess, and that it truly affects the health of the community. So when we're talking about risk communication, what I would like to see is, rather than focusing on how do we get people to trust us so we can do this thing, we should be thinking about it as, how do we communicate these risks to the public in a way that protects their health? Okay, we want to avoid harming people with how we communicate. And so it is possible, and I have, in one particular interview that I will never forget, this realization that the way the thing had been communicated had been almost as harmful to the community as the actual spill. And so this is a really key point that I don't think we talk about enough. So some of the things that you can do are prepared messaging. You can try to anticipate the public's concerns and then be ready-ish, because obviously you can't know everything that will happen. But one thing that happened that came out of some interviews I did was in Burnaby, the Burnaby oil spill in 2007, when a pipeline was ruptured and the oil geysered and covered a bunch of houses. About 250 people were evacuated. It was kind of a big deal. Actually, I sat beside a woman on the bus this morning who actually sold her house because she lived there, and she was so concerned about the long-term consequences of this. She sold and she left, even though it was a massive financial hit for her. So she decided she couldn't live there anymore because of that event. So in that event, however, town halls were found to be really important, because it allowed the people who were living there and people who were oiled and their homes were affected, allowed them to have very personal engagement with health experts, not necessarily just with emergency management people or the communications people, but the actual BC CDC people were in the room, and they talked. They talked about concerns. They also found a way to incorporate the views of those people into the criteria for what's clean enough. So they asked them, what do you think is clean enough? What should be our endpoint for cleaning up this situation? And they were told, and they did that, and it was quite successful. So social media is something to be really important, or really considerate of in risk communication, and that's because it can be a boon or a curse. So in Kalamazoo, which is a big inland oil spill in the Kalamazoo River in Michigan, the people that I spoke to there from the environmental health groups were very annoyed with Facebook and Twitter, because they had prepared a certain messaging, and they had a certain approach that they wanted to take, and then before that they could get that out, they got scooped, and it was on social media, and it was very difficult for them to, quote, control the narrative. I'm not saying that's the right thing to do, but when there's many sources of information and they're all competing with an equal level of legitimacy, this can be a really big problem for public health. On the other hand, social media was really important in Bella Bella in organizing the community to be involved in the response. So, it's really just something to be aware of. We also have issues with actually assessing the health impacts. So first of all, defining those health impacts, so long-term versus short. In Bella Bella, things like food security and safety were very important impacts. The diesel spill occurred over the area that was a critical commercial fishery for the area. So not only was their food supply compromised, but also their commercial profits were compromised, as well as a cultural impact, in that they had fished that clam bed or used that clam bed since time immemorial, and it was actually a very sharp blow to the community to lose that. And they don't know when it'll ever be usable again. That's kind of like the mentality is, do we ever trust this food source again? So ecological health and human health and the perhaps false distinction between them is something that came up a lot in Bella Bella. In Lac-Mégantic, it's assessing these long-term psychological effects. So that is something that we really need to pay more attention to. And specifically, how? So how we address those impacts. There's two kinds of things that NCCH is, or I'm looking into as part of the NCCH. First is how you do a rapid health assessment. That seems like a really easy thing to do, but it's actually really not. Rapid health assessments can be much more than triage. This is something I'm going to be working on more in the months to come, but there's also a higher level of information that we require. So it's not just the rapid health assessments, what are your symptoms, what are your mental health impacts, what are your needs that I can fill, but also what are the long-term impacts of what you've experienced. And so that's like true public health research that should be ongoing, but has some problems. So just briefly first, the rapid health assessments. This is the other picture I promised you. These are good-looking young hippies at Ambleside Beach cleaning up the oil spill in 1973. So this young lady is out there barefoot and in shorts and is up to her neck in oil. There were other pictures of people actually swimming out into the waves with materials to absorb the oil. And, you know, this is like full body exposure in the water. It's this very dangerous situation right here. That's another historical blog that's really cool if you're interested in that oil spill way back when. So rapid health assessments have a number of objectives. Am I way over time? No? Okay. The first thing is to assess those physical impacts and symptoms to figure out if somebody needs to be escorted to the emergency room. So you want to make sure that people are actually accessing healthcare. So if you go to the Bella Bella webinar, you'll hear the environmental health people there talking about how First Nations people felt symptoms. They experienced hallucinations, headaches, and other things. They chose not to go to the clinic. And it was a conscious choice not to access healthcare. And there's reasons for that. And so these are things that you need to be cognizant of. We also want to be at least starting to assess whether mental health packs are a thing. Sometimes you can't tell right away because people are in shock and they'll be all right in a little while. But sometimes there's indicators early on that this is like, for example, my culturally important food source has been compromised. Clearly, this is not going to be a short-term issue. So rapid health assessments can really set the foundation for that. They also, and this is like really critical, provide community members with a snapshot of their status immediately after the spill. So at some point in the future, somebody might say, well, what were your symptoms on the night of blah, blah, blah? And they can say, here, this is a doctor or a nurse came to me and this is what I experienced. So, the issues with these are that developing and deploying them is very time consuming and you need to be ready. Like you actually kind of need to be ready with templates already prepared because the first hours of an oil spill when there's a lot of VOCs in the air, those are really, it's kind of the critical time. And if you miss it, if you take too long to develop your survey, then the people who needed to be, for example, directed towards an ER may have already gotten very sick. So you need to be fast, and that's a big problem. There's another issue with who owns the information. You're collecting information about people's lives, and for example, First Nations community, that's a very sensitive situation. It doesn't necessarily belong to public health. So I'm working on something with Health Canada that's more directed at funding or at doing the actual public health research, not just the snapshot rapid health assessments, but much more, what do I want to say, like detailed long-term research into the long-term consequences of these spills. So we know that that kind of research can be very, very costly. And the problem with oil spills is that there's really no mechanism to fund it. So when you have a cleanup situation, there's a bunch of different sources for money. So the responsible party pays, their insurance pays, there's international funds that are supported by industry that pay, but none of that money is for health necessarily. So the exception to that is in the Deepwater Horizon. So BP knew that they had caused such a problem and it was such a PR nightmare that they actually devoted millions, if not tens of millions of dollars to human health research. And so we are learning from that learning a lot from that. In the US, they've recognized that actually doing public health research during an emergency, both for that response and to inform later responses, is very important. So what they've done is they've created a whole program And two of the primary characteristics of that are, first of all, creating a funding mechanism for a rapid release of money, and also an expedited ethical review mechanism. So you can't go short on ethics, on like protecting people's privacy information and not doing inappropriate research. So this is not a quickie review. This is a serious review, but it's just expedited. So the person in charge of this drops whatever they're doing and they read this thing first and they get it turned around in a few days rather than months. In Canada, we're working with Health Canada Chemical Emergency Preparedness Response Unit and the BC CDC and others on something similar to this. We're trying to figure out how it would work in Canada. It's not easily answered. We're working with a couple of people from the US who are very familiar with this, and it's proving to be an interesting challenge. So we're very much in the exploratory phase. But the idea is that one day Canadian responders will also have this ability to do some research during one of these events. So related to crude oil and our activities, on February 23rd, which you can't see very well here at the bottom of the screen, we are having another webinar through the BC CDC. It's February 23rd at 12 p.m. And it is about the Chemical Emergency Preparedness Response Unit's crude oil guidance document. So this is a guidance document that is aimed at public health practitioners, okay, so not at emergency response manager types, but at actual public health people who may be involved in a chemical emergency. And so it's very question and answer style, and it covers the range of everything from prevention or mitigation, planning, preparedness, response, recovery. So it's a really comprehensive document without being like overwhelmingly detailed. It's really the kind of what you need to know. It's not done yet, and it needs reviewers. So for those of you here who have deep environmental health background, if this is something you're interested in, I know they'd love to have more reviewers of their 80-page document. It's really good. And you can contact Mark LaFontaine if you're interested in that. So just before we take questions, I'm putting these in here so you have access to them. These are just some documents. The health, these two right here are the health effects papers. We also did something on the public health impacts of hydraulic fracturing last year, so that's kind of related to this, not exactly. There's also a very good report on the Marathassah fuel oil spill, which is quite informative. And these are the two webinars that I keep pointing people towards just because I think it's a really great way to learn about something that actually happened. So thanks to all of you, and these are the people I collaborate with the most. I guess we can take some questions. I didn't drink my coffee.
Thank you very much. Does anyone have any questions? Raise your hand and I will bring the microphone to you.
Hello.
Thanks very much. Hi, very educational.
Yeah.
I'm curious, in your literature review, when you were looking at health impact studies, how long has somebody actually followed up one of these events? Like, what was the longest follow-up period?
The longest, there's only been very few long-term studies, and are all by the same group of academics in the same spill. So it was in the Prestige oil spill, and they followed this group. There was a group of fishermen who were engaged as cleanup workers, and they followed them for 7 years. That was the longest they followed them for. But those were really good studies, but as I said, they were kind of like subclinical effects, and also there were a lot of concerns about who the control group was in those studies. There was they were very interesting, but a bit problematic. But 7 years, and that's really actually quite a long time to be following somebody.
I should ask one more question.
Sure.
I might have missed this as part of the explanation or introduction. You talked about the kind of overall response that happens and then the 5 appendices for specific events. So is all of this leading up to building an appendix specific to oil spills?
Yeah, I can't speak to that. That's Ministry of Environment, but they are, just in November, they released their 3rd intentions paper, which was basically this, I think, the summation of all of their public consultation. And so at this point, I think maybe they'll create another appendix, but also the BC Emergency Management has been changing a lot recently. So there's a new BC EMS guide out. The all hazards and the annexes are also being reviewed and updated right now. So I don't actually know what they'll put up, but Something like that. There's going to be something specific for oil spills, which is really great. Just if we have to now get our, on this side of things, the public health side of things, kind of get our own intentions and objectives straight and how we are going to meaningfully participate in this process. It's not on them, it's on us. Really, I think is kind of the point I'm trying to make.
Just a reminder, if you're asking questions in the room, please hold the mic up close to your mouth to keep people out.
Great. Thanks, Angela. That was wonderful. So my question is around the response, and one specific part. You were mentioning the town hall meetings, particularly around the Burnaby Mountains spill, and there. You know, you have all of these bits and pieces that go into the response, and I think for most of us in the room, we're very comfortable with the recognition, evaluation, right? You know, and that part of it. I'm wondering if you could speak a little bit more about the training and/or the approach and/or who were the people who actually conducted the town hall meetings and how was that received, just as a curiosity.
Unfortunately, I can't provide that detail, but the person who did it was Rick Hopes. And he is an eminently discussionable person. He loves to talk about this, and so but it's a good point. Like there are ways to do these things properly, and in the heat of the moment, you sometimes, like with this survey that has to be, if you have to develop a rapid health assessment, that is potentially going to be developed by somebody who doesn't know how to develop a survey. And so if that person is wise, and I know many wise people, they reach out and they get help on those sorts of things. But some people may feel like, oh, I got to do this right now. I have to just put together this thing, and if, of course, it's not well put together, it's not going to do you any good. But yeah, that goes for everything. That goes for risk communication. That goes for these kind of like public interactions. They all need to be very carefully thought out, which is why we're putting this out now, that these are things that need to be prepared ahead of time. If you know an oil spill is a likelihood in your area, and this is actually a local authority has a mandated responsibility to make that assessment. If I think an oil spill in my jurisdiction is likely, then I am required to do these things. And it's really just, you know, from us as public health practitioners, you know, what can we do to put into that or to input to that?
Hi, really interesting presentation. I should just introduce myself. I'm visiting from the University of Regina, and I had a question about the North Battleford spill, the Husky Oil one. Something that was really interesting in the media when they had scientists speak to it was the fact that this would have been a very serious public health issue had it occurred in the winter, and that the oil, the response to oil under ice, they don't have the capacity to clean up. I was wondering if you could comment on that.
Well, from like just the objective of eliminating exposure, they would have done the same thing then as now, which is that they would have shut off the drinking water intake. But the problem was that they only have a certain amount of, like, I think North Battleford had another reservoir that they were able to draw from, and there was some issues with rationing, if I'm correct, right? So yeah, I can't speak to that, but I do know the people. I was not directly involved in that, but I do know the people who were, and if you were interested, I could connect you to them. But it's yeah, it's a really good point.
And just a follow-up question. You had spoke to the outrage of communities that are affected.
Yeah.
Do you find that there's provincial differences? My perception was that people were concerned about the Husky oil spill, but in some ways had a more accepting, some had more accepting kind of disposition because they're involved in the resource extraction industry and that. And I don't know whether because they're not expressing outrage and concern over it, that may have actually more serious consequences for their health. They're kind of not expressing it, or what, do you see any differences?
I will say that I agree with you. I have noticed in past spills that when they happen in the prairies, there's much less kerfuffle. People do seem to be able to get over it, like at least in terms of like media coverage, more quickly. That's a really good question to ask. Perhaps some academic from universities in Saskatchewan could look into that, maybe. Yeah, it would be very interesting to know what's going on there. I'm not connected to that response, though, so I don't have those community contacts. I would like to get them to do a webinar, though. I just have to figure out, I know one of the MOHs to see if he would be willing to give a, but what I really would like to do is get like the community impact side, which is what we did with Bella Bella, so that's really good plan for the new year, thanks. Put it in the work plan, Lydia.
Angela, just want to find out how often does the incident command team meet and conduct exercise together?
That I don't know. It's very, if you're talking about like the environmental health professionals, it really depends on the health authority. So each municipality and regional district has to have their emergency plans. Each health authority has their emergency plans, and they're different. So that's just.
So they actually operate in sort of separately.
They do. They all have like the BC Emergency Management system requires that they all have a similar response structure, and that we're all like using the same tools to do things, but their schedules are different. And I know that Vancouver Coastal Health and Health Emergency Management BC are doing something right now, but I don't know exactly what's going on. It may be related to, I think it's related to a different way to, because Vancouver is several municipalities and it's two health authorities and PHSA, it's very, very complicated. So I think that they're actually trying to get together as a group and figure out how they could act as a region, have like a regional incident commander that would get, or a regional health representative that would input to that. So in answer to your question, different health authorities do different things, but they all have to have the basics covered.
I think it's really beneficial to have the different teams that join together and try to do exercise and just hash out any sort of challenges that they encounter. And
the EMBC and HEMBC are responsible for bringing people together for exercises, but I don't know the schedule on which that occurs. It should occur, though.
I think we have some online questions.
Great.
We do have a few online questions. I'm not sure we're going to have time for all of them. First, by mentioning that those within the Incident Command Center are required to follow the incident commander, are you implying that there's something in the emergency legislation that removes or overrides the general statutory decision-making authority of the health officer under the Public Health Act?
That's a good question. I think that no, because if there is a very demonstrable known health risk, that is going to be addressed, period. It's more when we get into these kind of ambiguous things like oil spills, like do we need to be looking at psychological exposure and what are some other data we should be collecting, then because it's just more ambiguous. But what was the first part of the question? Oh, yeah, sorry, the other thing I wanted to say. Nothing that I say here today should be taken as a critique of EMBC or the incident command system, because I'm being very clear, these are very effective ways to deal with emergencies. And as I've already said, it's not about ICS to do better for us, but for us to do better for ICS. So just whoever's out there, although I will say if you go to our webinar on Lac-Mégantic, the environmental health or public health person that was in charge of that, Melissa Genero, she spoke a little bit about how that was very obviously a public health disaster, and people were dead. There was like an evacuation. It was a very serious, like acute incident. And she does discuss in her talk a little bit about how the other side, the environmental side of it, actually tried to override some of her decisions. So I'm not going to say it can't happen, but obviously human health is paramount in any response.
Okay, in your experience, how should we message the information where exposure and health effects are likely? What are some mistakes that should be avoided?
Okay. The truth is that writing these kind of documents for the public are really, really difficult. With fuel spills, what people are most concerned about is the big C. They want to know if they're going to get cancer from this. And like that's despite the fact that if you're exposed to, if your entire body is dipped in diesel for a period of time, you have much more serious problems than cancer. So, I mean, the goal with those documents is like when public health people write them, sometimes they write them in a very precautionary way. You have to be very careful of that, because if you scare people, that is a health impact. You never want to write something that's going to terrify people. And that, we do that sometimes by kind of overemphasizing the risks. So yeah, it's not an easy question to answer. It takes a lot of skill to write something that is fully informative, but at the same time not terrifying. The World Health Organization, they put out a thing on diesel, and I remember liking it a lot because they said, they just said straight out, you know, a one-time exposure to diesel is not a problem. You don't have to worry about it. Like very colloquial language, and that felt very calming to me. On the other hand, I've seen other documents that are just like, I looked at them and I went, oh my God, what's going to happen?
Okay, this one I think will be quite short. Has there been any research looking at spills from different sources, a pipeline leak compared with a railway derailment or accident?
Yeah, well, there has been very little research on pipeline spills because there have been many more pipeline spills than tanker spills, but of course they're much smaller. So the public health research seems to only occur in response to these massive spills, but it's all about exposure, right? So if we know something about exposure from the marine spills, then we can perhaps infer something about the land-based spills. It's also about what is being spilled. So there's many, people seem to think that like oil spills are all one product being pumped out onto the ground. They're not. They're very different, and this has been a question when we're like developing communication about what are the risks here when we're like, what is the substance? Does anybody know what that substance is? And are we sure that that was the only thing that was in there? So it's really difficult.
And I will ask a question because I have the mic.
You
were saying that there's no clear mechanism for funding public health research when these events occur.
Yeah.
Is there a clear mechanism or precedent for funding occupational health research when these events occur? How much literature is there in that realm?
I don't know. I really don't know. I think that the cleanup workers kind of fly under the radar because for an oil spill, for a marine oil spill, and I think also for the land-based spills, when a spill occurs, Western Marine Response Corporation kicks into gear and they put their workers out there, and everybody just says they are responsible for their workers, and everybody assumes that that's the case. And they're, you know, they work with WorkSafe BC. So, but I don't know about any kind of occupational funding for that. In the U.S., it's amazing. If there's a big spill and there's the potential for a public health impact, somebody sits down, writes a check for $1 million, and says, "Here, go do something about it." Yeah, we just don't have that ability here. Go ahead, Mike.
So just a quick comment on the issue of sort of outrage in communities. There is a little bit of literature I know of from mining that does show that sort of communities that are dependent on mining tend to view the risks of mining less than other communities, but nothing I know of with oil spills. What I want to ask you about is, if you can very quickly, just for this audience, I remember when you were doing the first lit review, just there were some sort of interesting, I guess, occupational health concerns that arose. Primarily, I'm kind of thinking of cleanup. Just maybe if you could elaborate a little bit more on what some of the issues are.
Yeah, so there was a lot of work done in the Korean oil spill. And so I'm just trying to think back because it was really complex. There was many different people. There was volunteers involved. There was the military was pressed into service. And there was also professional paid cleanup workers. So do you mean like the kind of toxic effects or like the determinants?
What struck me, I remember like issues with people like slipping on rocks and back injuries and things that you might not necessarily associate with an oil spill were kind of the more prominent things.
Yeah, so that I only talked about toxic effects here, but in the actual review I go a lot more into like injuries. And obviously if the rocks are covered in oil, it's a very dangerous work environment, and this is another big reason why you don't want volunteers near a beach, is because it becomes imminently hazardous to the person. And so basically what they found in different spills were a lot of slip and fall, concussion, broken arm, broken leg, lacerations, with wildlife handling, a lot of lacerations and bites for obvious reasons. And that's why we tell people, you know, wildlife handlers have to be trained. You don't just go down to the beach and pick up a duck and try to like wash it off in your sink. It's dangerous for the animal and it's dangerous for you. But of course people are like well-intentioned. It's just not a great idea. But it's all about PPE really. So I mean, even with like really good boots and like different protective equipment, you're still relatively dangerous. But there's been places where people have gone out with a handkerchief on their face and some rope wrapped around their feet, and that's what they're cleaning. Or you know, this barefoot young woman, I think her name is Pam or something, in that one video from Ambleside, barefoot. So yeah, there was a lot of physical injuries, as well as in one really sad spill in Japan, a couple of heart attacks, because the people that went down to the beach happened to be very aged and were so incredibly stressed out by what they saw, one assumes had a heart attack and died. So.
Okay, that's all the time we have. Please join me in thanking Dr.